So if he's happy, then we'll leave it alone. But you sure wonder about a pancreatic cancer pain.
Dr. Bill Mitchell is an oncologist at Moore's Cancer Center in San Diego, and he's also a palliative care doctor. Palliative medicine aims to treat all symptoms that accompany a serious illness: pain, anxiety, even fear. Many of the patients Mitchell sees are dying, and sometimes he has to ask them to make a difficult choice: continue chemotherapy, which won't cure their disease but could make them feel better, or choose hospice, which provides home care, visits from a nurse, home health aides, medicine to help with pain.
There are patients that really need hospice and really need chemotherapy that would genuinely benefit from both, that would feel better, live longer if they got both. But the reality is hospices can't afford to do that.
Medicare pays for hospice care. It's a daily rate for people who have 6 months or less to live. Hospices legally have the option to give patients chemotherapy, radiation, and even blood transfusions if they're used to palliate symptoms. In other words, make them feel better.
But the hospice has to pay for that. And they aren't reimbursed enough money to cover that. They'll go out of business.
And so hospices must also choose: give a dying patient chemo or radiation so they feel better, maybe even live longer, but perhaps lose money. San Diego Hospice routinely gave dying patients so-called curative treatments: chemo, radiation, blood transfusions, and hospice care. It's not clear how the hospice was able to pay for those treatments or whether providing them contributed to its financial demise. The hospice is currently in bankruptcy court.
And are you taking LASIK still?
Dr. Eric Rowland is also a cancer doctor, and he's trained in palliative medicine. Both Rowland and Mitchell did their palliative training at San Diego Hospice.
Many patients that I took care of getting expensive treatments, blood transfusions, chemotherapy, radiation treatments, and a whole host of other things.
Who are anemic, have a high risk of bleeding, but boy, they just really wanted to get to that graduation, or they just really wanted to go to that wedding. And so they got their blood transfusion once a week.
The mantra was do the right thing for the patient. If it ends up costing us some more money, it's the right thing for the patient.
And as practicing oncologists, they referred patients to San Diego Hospice.
I had a patient who was very, very ill with a metastatic lung cancer, and she was so ill that she could barely speak, completely bedbound. She was too sick for chemotherapy, but we have a very expensive oral drug. Then we're left with this decision, what to do. San Diego Hospice paid for the drug.
And how much?
$4,000 a month. $4,000 a month for 8 months. So we did. This patient went from bedbound and unable to speak to sitting up at the table and peeling vegetables, helping her family prepare dinner. A prognosis that I had estimated on the order of a few weeks became 8 months before she died. And those were 8 good months. She needed both, desperately.
The new federal health care law was supposed to experiment with allowing dying patients to choose both hospice care and so-called curative treatments. In fact, the legal framework is in place to allow 15 hospices across the country to do so, but the money for the project has yet to be approved.
This hospice benefit is operating under the assumption that these are black or white. You get either or, A or B. And in all reality, if it were you or me, the choice is C, all the above. You want all the above. That's the right thing to do for people.
The risk is that if we learn that anti-cancer treatment and hospice care together make a big difference, we might have to pay for both simultaneously. Nobody knows for sure whether that's cheaper. There's a concern that it's more expensive.
Just how much money should matter at the end of life is a big question. Already, a quarter of all Medicare dollars are spent in the last year of life. From the KPBS and iNews Source Investigations Desk, I'm Joanne Farian.